Personality disorders. Personality disorders refer to a number of conditions in which a person's characteristics in terms of how they think, perceive, feel, or relate to others differs significantly from the norm. Changes in how a person feels and distorted beliefs about other people can lead to very strange and distressing behaviour. The main symptoms are being overwhelmed by negative feelings such as distress, anxiety, worthlessness or anger, avoiding other people and feeling empty and emotionally disconnected, self-harming as a result of difficulty managing negative feelings, use of drugs, violence, alcohol, etc. Peculiar behaviour compared to social norms, great difficulty in maintaining stable relationships, and periods of losing contact with reality. People with personality disorders often have other mental health problems such as depression and substance abuse. Their symptoms often become even worse in stressful situations and when using drugs or alcohol. Personality disorders usually become evident during adolescence and then continue into adulthood. The effects may vary from very mild to severe, and sufferers may even have periods when they function in line with socially accepted standards. Feelings of extreme distress or fear during childhood are common. Types of personality disorder. Several different types of personality disorder are observed. They are grouped into one of three clusters: A, B, or C. Cluster A personality disorders. A person with a Cluster A personality disorder tends to have difficulty relating to others and usually shows patterns of behaviour that most people would regard as odd and eccentric. The main personality disorders in this category are A1, paranoid personality disorder. Thinking other people are lying to them or trying to manipulate them. Extremely distrustful and suspicious. Feeling that they cannot trust friends and associates. Worrying that any information shared with others will be used against them. Thinking there are hidden meanings behind remarks that most people would regard as innocent. Concern that their partner is unfaithful for no good reason. A2, schizoid personality disorder. A person with a schizoid personality disorder may appear cold and detached and avoid making close contact with others. Other symptoms include preferring to take part in activities without interaction with others, reluctance to form close relationships, having limited ability to experience pleasure or happiness, and being uninterested when receiving criticism or praise. A3, schizotypal personality disorder. A person with a schizotypal personality disorder is likely to have poor social skills and delusional thoughts and behave in unusual ways. Other symptoms include attaching undue and misguided significance to everyday events, such as thinking newspaper headlines are secret messages to them. Believing in special powers such as telepathy or the ability to influence other people's emotions and actions. Having unusual ways of speaking, such as long, vague sentences or going off on a tangent. Experiencing excessive anxiety in social situations, even if they have known a particular person or group for a long time. Cluster B personality disorders. A person with a Cluster B personality disorder struggles to relate to others. As a result, they demonstrate behaviours that most people would regard as dramatic, erratic, and threatening or disturbing. The main personality disorders in this category are B1, antisocial personality disorder. A person with an antisocial personality disorder sees other people as vulnerable and may intimidate or bully others without remorse. They lack concern about consequences their actions may have. Symptoms include lack of concern, regret or remorse about other people's distress, irresponsibility and disregard for normal social behaviour, difficulty in sustaining long-term relationships, little ability to tolerate frustration and to control their anger, lack of guilt or not learning from their mistakes, and blaming others for problems in their lives. B2, borderline personality disorder. A person with a borderline personality disorder is emotionally unstable, has impulses to self-harm, and has very intense and unstable relationships with others. B3, histrionic personality disorder. A person with a histrionic personality disorder is anxious about being ignored. As a result, they feel a compulsion to be noticed and the centre of everybody's attention. Symptoms and behaviours include displaying excessive emotion, yet appearing to lack real emotional sincerity, dressing provocatively and engaging in inappropriate flirting or sexually seductive behaviour, moving quickly from one emotional state to another, being self-centred and caring little about other people, constantly seeking reassurance and approval from other people. Symptoms and signs may coexist with borderline and narcissistic personality disorders. B4, narcissistic personality disorder. A person with a narcissistic personality disorder swings between seeing themselves as special and fearing they are worthless. They may act as if they have an inflated sense of their own importance and show an intense need for other people to look at them. Other symptoms include exaggerating their own achievements and abilities, thinking they are entitled to be treated better than other people, exploiting other people for their own personal gain, lacking empathy for other people's weaknesses, looking down on people they feel are beneath them, while feeling deeply envious of people they see as being above them. Cluster C personality disorders. A person with a Cluster C personality disorder fears personal relationships and shows patterns of anxious and fearful behaviour around other people. Others may be withdrawn and reluctant to socialise. The main personality disorders in this category are C1, avoidant personality disorder. A person with an avoidant personality disorder appears painfully shy, is socially inhibited, feels inadequate, and is extremely sensitive to rejection. Unlike people with schizoid personality disorders, they do desire close relationship with others, but lack the confidence and ability to form them. C2. Dependent personality disorder. A person with a dependent personality disorder feels that they have no ability to be independent. They may show an excessive need for others to look after them and are clingy. Other symptoms include finding it difficult to make decisions without other people's guidance, needing others to take responsibility over what should be their own important life choices, not being able to express disagreement with other people, finding it difficult to start new activities due to a lack of confidence, going to extremes to obtain support and comfort, feeling helpless and uncomfortable when alone, urgently needing to start a new relationship once a previous relationship comes to an end, having an unrealistic and constant fear that they'll be left alone to fend for themselves. C3. Obsessive compulsive personality disorder. A person with an obsessive compulsive personality disorder is anxious about issues that seem out of their control or messy. They are preoccupied with orderliness and ways to control their environment, and may come across to others as a control freak. Other symptoms include having an excessive interest in lists, timetables, and rules, being so concerned with completing a task perfectly that they have problems completing it at all, being a workaholic, having very rigid views about issues such as morality, ethics, and how a person should behave in daily life, hoarding items that seem to have no monetary or sentimental value, being unable to delegate tasks to other people, disliking spending money as they think it's always better to save for a rainy day. This personality disorder differs from obsessive compulsive disorder, a related mental health condition, in several important ways. People with OCD are aware their behaviour is abnormal and are anxious about it. Most people with obsessive compulsive personality disorder think their behaviour is perfectly acceptable and they have no desire to change it. Some people with OCD are compelled to carry out rituals, such as having to touch every second lamppost as they walk down the street. This is not usually the case with people that have obsessive compulsive personality disorder. People with OCD may feel compelled to make lists or organise items in their house, but they feel anxious about doing so. People with obsessive compulsive personality disorder find relief from anxiety when doing such tasks and may become irritated when prevented from doing so. How many people are affected? Personality disorders are common mental health problems. It is estimated that approximately 5% of people have some type of personality disorder. However, many people have only mild conditions, so only need help during stressful times. People with more severe problems need sustained specialist help. Outlook. Most people recover from personality disorders over time. Sometimes a psychological or medical treatment is helpful, or simply some form of support. This depends on the severity of the disorder and whether there are any ongoing problems. Some mild to moderate personality disorders improve with therapy. Different types of psychological therapies have been shown to help people with personality disorders. However, there is no single approach that suits everyone, and treatment should be tailored to the individual. Not all therapies are effective, and it is therefore essential that a trained therapist delivers them.